The forced swim tests, one of the simplest experiments still done on animals in universities and commercial labs. But they're useless and kill thousands upon thousands of rats and small animals each year. How you can stop the tests. Next on the PETA Podcast. Welcome to the PETA Podcast. I'm Emil Guillermo, your host for this behind-the-scenes look at PETA, the largest animal rights organization in the world. Here we talk to the key players at PETA and the movement and ask them about how animal rights change their lives and how they stay motivated to make the world a better place for the animals. On today's episode, useless animal experiments, the fallacy of the forced swim tests.
And they would drop an animal, usually a mouse or a rat, but sometimes also gerbils, for example. And they would drop the animal into the beaker of water and then watch as that animal struggled to stay afloat. And keep in mind, this beaker of water has no route of escape. They try, in vain to scratch up the sides of the wall, but they keep slipping down into the water. They obviously experience the sensation that they're about to die because they're struggling to stay afloat and not drown. And then eventually what happens is the animal stops struggling and just sort of floats there. Or on occasion, actually, the animals do sink and drown.
Jeremy Beckham, PETA researcher in the Laboratory Investigations Department, describes the forced swim test, what he found out about the test in universities, what pharmaceutical companies say about the tests, and the lack of oversight on researchers. All that on this episode of the PETA Podcast. But first, thanks again for joining us here at the PETA Podcast. Please share a link with friends. Let them know the animals have a voice on the PETA Podcast. And keep binging. There's lots to listen to here on the PETA Podcast. Meet PETA President and co-founder Ingrid Newkirk in Episode 1. She debunks all the myths you may have heard about PETA. Do they really have supplies of blood for activists to throw on fur coats at protests? Of course not. Ingrid knows the truth. Hear about how the idiomatic phrase, bring home the bacon, should no longer be uttered, at least not in a vegan world. All that in an upcoming podcast. And find out more about animal testing like that at Texas A&M. Check out Episode 32 and Episode 9. Remember, if you're on Apple Podcasts, don't forget to rate and review the show. It helps the algorithm know that PETA has a podcast on the issues important to you. Listen to us on all platforms, Spotify, Stitcher, wherever you listen. And if we're not there, send me a message. We'll get it on. Now, if you really want to help the animals, you can always hit the Donate Now button at PETA.org. And if you're high-tech and have Amazon's Alexa, it's as easy as saying, Alexa, donate to PETA. Now to our episode. Some people don't think twice when it comes to experimenting on animals. They think it's standard operating procedure, something that's necessary. But it's a useless step in university research and commercial research for drugs or medical remedies. In fact, the results in animal testing have little to no relevance to humans. So why do they do it? A look at a typical test, the forced swim test, reveals how futile and cruel even the simplest of tests can be. Drop an animal in a tube of water and watch it struggle or die. What PETA found, the failure of the oversight committees at universities to monitor abuse, it's all in my conversation with PETA's Jeremy Beckham on the PETA Podcast. Since we talked last time, I have seen that PETA is trying to end the forced swim test. So what is the forced swim test? What does it involve?
So one of the things that animal experimenters do is they don't just have a particular study or experiment necessarily that they're employing. They actually create a general condition in an animal and then use that animal for a whole variety of experiments or use that conditioned animal. So to take one other example, they have some monkeys that they have injected a chemical in them to introduce Parkinson's symptoms. And then they use that monkey for all kinds of tests that are supposed to simulate Parkinson's.
It's like a designated animal that now that they've primed it to be tested, it becomes the test animal?
Exactly. It's almost like this conditioned animal is like a surrogate for a condition now. if that makes sense. So it's not even just that this individual animal is standing in for humans generally, but this individual type of animal, we've done something to this animal where now this animal stands in for humans with Parkinson's or, XYZ condition, right? So what they've done is they wanted to create an animal model at the time, they said, of despair. That was actually what they said in the 1950s. That's how they created this forced swim test. They wanted to create a condition of despair in an animal model.
A condition of despair in an animal. So that means they have to put the animal in some kind of stressful condition so that you might get this feeling of despair in the animal?
Exactly. That's the entire point of the experiment. That's the goal of this experiment, is trying to induce that condition in an animal of despair.
How does forced swim get into the equation?
So what they did was they took a beaker of water and they would drop an animal, usually a mouse or a rat, but sometimes also gerbils, for example, and they would drop the animal into the beaker of water and then watch as that animal struggled to stay afloat. And keep in mind, this beaker of water has no route of escape. They try, in vain to scratch up the sides of the wall, but they keep slipping down into the water. They obviously experience the sensation that they're about to die because they're, struggling to stay afloat and not drown. And then eventually what happens is the animal stops struggling and just sort of floats there. Or on occasion, actually, the animals do sink and drown. That does happen sometimes. But usually the animal just kind of gives up and then just stays and floats there. And what they do is they'll time that. They'll have a stopwatch and they'll measure it. And the amount of time that it takes for the animal to reach that condition of despair is supposedly what tells us something about the mental health of that animal and whether or not that animal is depressed or not.
Is that the point before the animal dies, or is it? Can they tell something by the action or by observation how the animal acts? How do they know it's despair?
They don't know it's despair. They're just making that kind of assumption about the internal thought process of the animal. It's very possible that that animal's just, conserving energy and realizes just almost in a logical sense that there's no point to keep struggling because there's no escape from the beaker. But that is what they do. They just watch and record and wait until that animal just gives up and just floats there. But what's shocking is, we found online, some of these experimenters film their own experiments, and we actually found them on publicly available sources. And you see these animals struggling and swimming and struggling, and sometimes they would even defecate in the beakers of water, an obvious sign of extreme stress before they gave up. So, I mean, it's pretty clearly a terrifying experience for these animals.
Now, describe the beaker. Is it like a foot long? Is it a small beaker? How long or how large is the beaker?
They come in a variety of sizes, I guess, but they're, I don't know, maybe a 6-inch circumference or something is what I often see in the videos.
Yeah, how tall?
Maybe a foot. It's a pretty small beaker.
So a foot long beaker, 6 inches in circumference. They drop a conditioned animal, a rat or gerbil, into this water, and then they see how it reacts?
Right. They see how long it takes for the animal to give up trying to escape the water.
Who does this experiment, and why did they do it?
Well, sadly, it's remarkably commonplace. It's an experiment that's happening at universities all over the country. It's also even done a little bit by private industry. It has its origins at Johns Hopkins University, but really it's a pretty common experiment in psychological research. But what we were really shocked to find was that there are some private pharmaceutical companies that have had a history of doing it as well. We identified four specifically: Pfizer, Bristol Myers Squibb, Eli Lilly, and AbbVie, which is part of Abbott Labs. And the ostensible reason that they do this is to test experimental antidepressants. So they'll take 2 groups of rats or mice, and they will give one group a placebo and another group the experimental antidepressant, and they'll see if the animal who has the antidepressant swims longer, and therefore it's presumed that that antidepressant had a positive effect on that animal because they don't reach despair as quickly, so they must not be as depressed. That's the supposed rationale behind this.
Yeah, so the animal, the drug has worked. The animal is well enough to keep swimming. And so, ergo, this drug might work on people too.
That's supposedly the rationale. Of course, as common sense would probably tell you, the experiment doesn't really tell you anything meaningful at all. It has high rates of both false positives and false negatives, which means that some substances that look like they have an antidepressant effect using this test don't actually have an antidepressant effect in humans. A classic example of that would be caffeine. So if you were to give animals caffeine and then drop them in this beaker of water, they're going to swim around longer than those without caffeine. Okay? So under this logic, caffeine is an antidepressant. Now, that's obviously absurd, but that's what this test would lead you to believe. And there's also been some false negatives. Some drugs that we know are effective antidepressants don't have any meaningful or as far as we can tell, statistically significant effect on animals who have undergone the forced swim test. But nevertheless, these 4 companies that I named, we did a literature search, and we identified just in the published literature papers where more than 7,000 mice, rats, gerbils, and guinea pigs had been subjected to this test. So it's happened repeatedly over years to many, many animals. It's horrible.
And now, why is it though? Is it just that this is the way it's always been done? This is a tried and true test, or tried and true meaning that this is a standard thing that experimenters know that they can do. So it's too hard to extricate it from their protocols. That here it is. We know this forced swim test can provide us with data or some information. It's probably cheap, I would imagine. In terms of you need a conditioned animal and a beaker and some water, and then you observe. So it's fairly simple and even primitive, but it sounds like it doesn't have, or it doesn't provide the information that they think that it does.
For all of those reasons that it continues, a lot of it, like you said, is just simple inertia. This is kind of the way things have always been done, so it's the way things will continue to be done. The other thing that's really important to remember about pharmaceutical research and development in particular is when it comes to the costs of developing a new drug, about 99% of the cost of developing a new drug comes from the human clinical trials. That's the lion's share of bringing that drug onto the market, is testing that drug in human volunteers. The preclinical animal stuff, to big pharma who have practically bottomless pockets, that is a drop in the bucket. So even if there's a 0.0001% relevancy rate or whatever, it makes no difference to them. This is remarkably cheap to them. It's practically free to carry out these experiments. And what pharmaceutical companies like about animal testing is when they go to the FDA to seek approval to go to clinical trials, they can choose what data they want to hand to the FDA in their investigational new drug application. Okay, so they go to the FDA and they say, here are the various tests we've done. Perhaps some of the tests are in vitro, but there's always some animal testing as well. And still carry out a whole battery of tests on animals. They'll probably test it in monkeys, in dogs, in rats, and they'll do a variety of types of experiments on these animals. And one of them may be the forced swim test. And what they'll do is they'll cherry pick the results. So they choose only the ones that look good for their drug and present it all to the FDA as a giant stack of paperwork so they can proceed to clinical trials. And any little, grain of salt they can add to that stack, they're going to go ahead and pursue, even if it's complete nonsense testing like this forced swim test.
Right. So it kind of beefs up their case in a way, but as you point out, all these pre-tests are kind of meaningless when the big show is in the human trials. The human trials, that's going to determine whether or not it goes to market, right? It's not these animal tests.
That's right. And that's why 95% of drugs that appear safe and effective in animal studies, when they go to clinical trials, they fail. They fail either because they're ineffective in the humans, or sometimes they even maim and seriously harm humans. And many of these drugs, in fact, that look safe and effective in animal studies, fail in phase 1 clinical trials. So the second they're tried in only a handful of humans, it's obvious that the drugs are ineffective or dangerous. The forced swim test is just one example among many of the pseudoscientific tests that make up all of this preclinical animal testing. It's just fits the pattern.
But if they could stop it, and they could, as you say, the cost is a drop in the bucket. They could just get to the human test, but they could skip the pre-animal testing and go straight to the human test if they want, right?
No, there is a regulation on the books that's been there since the early 1960s. It's an archaic regulation that needs to be updated, but before any drug can go to clinical trials, it's required to be tested on at least 2 different animal species.
So they have to test sort of because of the law.
They do have to test on animals, but they don't have to do the forced swim test.
And they probably could come up, if the law requires a test, they probably could come up with a better test that means something.
Oh, sure. And in fact, when we reached out to these 4 companies that I mentioned and sent them letters, a few of them have already written back to us to say we haven't done the forced swim test in many years. And, we're kind of looking into those claims, and we're trying to get more serious commitments from them that they're not going to do them going forward. But I mean, it's clearly discretionary for them whether or not to carry out this particular test.
And so the pharmaceutical companies may claim, and you're checking that they're not doing it, but other people are doing the forced swim test in university labs around the country, around the world, right?
Yep, it's basically you can almost think of it as like a technique or something. It's a fairly common way to try to supposedly reproduce a mental state of despair in an animal.
On the forced swim test, Jeremy, how about other universities? Do they can still continue to use the forced swim test, and for what reason?
Universities are generally engaged in I guess you could say, a different kind of research enterprise altogether. There's a distinction you'll often hear between basic research or applied research. So basic research is basically knowledge for knowledge's sake. So in a bizarre sense, it's harder to attack it because it's not clear from the outset what the point of it even is. So if it was in university settings when they're doing forced swim tests, it's under the banner of basic research. So it's sort of you have to approach from a different angle of attack. When pharmaceutical companies are doing the forced swim test, it's supposedly for a specific aim of identifying new potential antidepressant substances, right? New novel substances that could have an antidepressant effect. And so the reason we're kind of focusing on the pharmaceutical companies in this sense is the evidence for that specific goal. It's overwhelmingly obvious that the forced swim test is horrible for achieving that goal. So that's kind of why the angle of attack at the pharmaceutical companies is a little more advantageous, because they have a specific goal in mind, and we can demonstrate clearly that this forced swim test isn't helping you achieve that goal. And, that may be why a couple of them have already perhaps moved on already, because it's already being recognized that this test is poor at predicting potential antidepressants.
But how can you stop the forced swim test at the universities that are using it for basic knowledge?
Well, you'd have to either get the university to stop doing it because of a public outcry. That's very often how we win our campaigns. Or you have to attack it on the other end, which is the funding agency. You'd have to get usually it's the NIH, the National Institutes of Health. You'd have to get them to pull the funding for it. And you just have to make the argument that we always do, that's true, that it's cruel and a waste of time.
And yet, the forced swim test continues to be administered.
Yeah, welcome to the world of vivisection. I mean, there are so many cases like this where, they've been doing the same muscular dystrophy experiments on dogs at Texas A&M University now for more than 30 years without any kind of result. I mean, there are animal laboratories at just about every major research university in the country that have been, that have had pointless pursuits ongoing for decades. And that's just the name of the game.
And it's probably also due to the fact that it's, not very costly. You got a beaker, you got some water, you condition animals. It's bad for the animals. You kill them, but it must be fairly cost effective for their pursuit. No,
not only is it not very costly, it's profitable. I mean, you bring in a research grant from the NIH to carry out your forced swim test studies, and for every single dollar of that NIH grant, about 50 cents of that dollar goes into the university's general budget to help build new buildings or used for a whole variety of purposes. They call those, quote, indirect costs. So not only is it cost effective, but experiments in animals are a revenue generator. So, I mean, that's the reason this keeps on going year after year and, in fact, keeps growing.
And so you won't find universities necessarily or university labs looking to try to end the forced swim test anytime soon, really.
I mean, the forced swim test from their perspective is not meaningfully different than all of the other worthless animal experiments that are occurring on rats and mice and other animals at their institution, if that makes sense. So, if we put enough pressure, sometimes if concerned people, if PETA or other groups too, put enough pressure on this experiment or that, sometimes you can end this or that experiment. But the enterprise as a whole really is based on fraud and continues year after year without producing anything meaningful. But people and institutions make money off of it. So, of course, it's going to continue.
All right. So let's move from the forced swim test to research in general. You've launched a new campaign at the Colorado State University since we last talked. What are they doing at Colorado State University?
So at Colorado State University, there's an experimenter named Gregory Ebel, and he's received more than $4.2 million in federal funding from the NIH since 2007 to experiment on birds. He's trapping crows and sparrows, and then he's infecting them with the West Nile virus. And I think one of the things that really grabbed us about this experiment was these are animals who have only known the wild for their lives. And he's setting out traps for them so that he can bring them into a laboratory and infect them with this virus and then watch as the virus ravages their bodies. It infects their lungs, their hearts, their livers, their kidneys, and their spleens. And then eventually it can affect their nervous systems and kill them. In fact, for crows, it's nearly always lethal. And so this just struck us as a particularly hideous experiment. I mean, even the act of trapping and confining these wild birds is an act of hideous cruelty. And then just to add insult to injury, to infect them with West Nile virus and watch them slowly die is just beyond the pale, and it should stop immediately.
What is the possible benefit from these tests?
He's just interested in studying how the virus propagates in the bird organism. So, kind of like I was mentioning earlier, these are academic researchers who have their own little intellectual curiosities. And to them, animals are nothing more than a test tube. So they don't really care or think about the ethical dimensions about what they're doing. They just want to continue publishing papers, bringing in research grants. So from their perspective, that is the point. Now, after we called attention to this cruelty, the university has come out and has claimed that these experiments are going to help bring West Nile virus outbreaks under control, and that it's even going to help avian populations, they claim, because the West Nile virus, there's a transmission cycle between mosquitoes and crows, and it kills crows in the wild as well. But if you want to control the West Nile virus, we already know the answer to that. In fact, it's happening all over the country all the time, and that's just with mosquito control. You control the vector, and you do that by draining bodies of standing water. So if we were really concerned about that, we would take this money that's being spent trapping wild animals and killing them, and instead we would direct it towards mosquito control programs that will actually control West Nile virus and we'd leave the birds alone.
Well, let me play devil's advocate for a bit. Now, the animal experimenters, ultimately, they feel justified because they're trying to help humans, right? I mean, they wouldn't do these experiments if they didn't really have to, would they?
Well, show me the money. Let's see the results. Every animal experimenter says they're carrying out their experiments because they're going to cure cancer, they're going to cure HIV, they're going to cure heart disease, or this or that. They've been saying these things for decades, and their claims essentially never pan out, and neither will this one. And we already know why it's not going to pan out, because viruses have species-specific pathogenicities. In fact, that's why this experimenter is using birds. He's specifically using birds because of the different ways that the virus will behave in a different species of organism. So there's not going to be relevance for humans that get West Nile virus for these experiments. They've already been going on for 10 years. I don't know at what point we finally come to the realization that the track record of decades of billions of dollars being spent on animal experiments with essentially nothing to show for it is time to recognize that this is a failed paradigm.
All right, but where is the oversight? There certainly should be some oversight. Who's making sure that the animals aren't harmed more than absolutely necessary?
So the universities will point to these bodies called Institutional Animal Care and Use Committees, which is kind of a mouthful, I know, but the acronym is IACUC, Institutional Animal Care and Use Committee. Yep. And there have been a few different studies that have looked at these bodies. These IACUCs are associated with the institution where the research is carried out. So in this case, Colorado State University has their own IACUC. And this experimenter writes up a detailed plan of what he wants to do to these animals. That detailed plan is called a protocol. So this experimenter will then take his protocol and submit it to this body of individuals called the IACUC. And the IACUC will review and either approve or theoretically, although it never pretty much happens, deny the proposed experiment. And so the university will say that this IACUC is what guarantees that the animals are treated humanely and that only the most meaningful scientific issues are researched. But when you really scratch beneath the surface, you realize that these IACUCs are nothing more than rubber stamp committees. And there have been multiple peer-reviewed studies that have looked at these IACUCs and have found a number of problems with them. The first one is just the makeup of who the committee members are. The overwhelming majority of IACUCs are staffed by other animal experimenters from within that same institution. Okay? So these are like-minded people, and most of them, in fact, have their own research projects that at some point they're going to be submitting to the IACUC. So a certain ethic often develops on these IACUCs of a you scratch my back, I scratch yours. That if you're going to be a troublemaker and oppose other people's experiments, well, does that mean your experiment's going to be looked at a lot harder now? So they become very compliant. And studies looking at their approval ratings, or how often they approve a study, find that they're through the roof. They approve almost everything that they look at.
So the oversight folks aren't really oversight folks. They're really collaborators in some ways. PETA is protesting. If people are hearing this program and they want to do something about this, and say they live near a major research institution, a university, well, what can they do? What kind of protest or what kind of voice do people in communities and people who are animal lovers, what kind of ways do they have to protest these kind of activities?
Gosh, they can do a lot. The first thing I would do, it may sound cliche, but I think it's true, is go to our website, PETA.org. We have a whole variety of action alerts on our website related to the use of animals in experiments. So you can go on there and find our action alert for Colorado State University and fill out our little form, and a message will go to the president of the university urging that these experiments be stopped. And there are similar action alerts for laboratories around the country. On the website, you can also sign up to be part of an action team that we have, where we will send you out an email or a text message whenever there's a protest in your area to help mobilize folks to show up and hopefully get some press attention to care about the issue. And we'll even help you organize your own protest. I personally, all the time on an almost daily basis, I help local folks all around the country conduct research into what experiments are going on in their neighborhood. It can be a little tricky or complicated trying to figure out what's going on. I mean, obviously, the animal experimentation industry doesn't proudly advertise what they're doing. You have to learn how to really dig into this. But I'm happy to help people with that. So, of course, reach out and connect to PETA, and we'd happily put people in touch with that. Also, of course, because so much of this is funded by the federal government, regularly contact your members of Congress about this issue. Obviously, one voice, reaching out to a member of Congress may not seem like much, but it all adds up. If thousands of us are doing this, it registers on their minds that this is an issue of public concern. So I think all of those are some small things people can do to get started.
And, one of the things that most people will encounter is they will encounter people who say, oh, wait a minute. These guys, the scientists, the researchers, they wouldn't be doing this if it didn't help people. And they'll point out to all of the medical breakthroughs of the past. They'll say, look at polio, the vaccine, look at antibiotics and the like. and animals were important for all that, right, Jeremy? We needed that, right? No?
Well, first of all, it turns out if you really look at the history of how a lot of those therapies were developed, the history is a lot more complicated than they would make you believe it was. So let's take quickly a look at those two examples you just cited. The polio vaccine. For decades, we thought that humans contracted the polio virus through their nasal canal. So we were developing all of these nasal spray vaccines to try to use on humans. And this is because monkeys actually do contract polio virus through their nose. We contract it through our gut. So we were led astray for decades. In fact, the Dr. Albert Sabin, who invented the oral polio vaccine, he testified in front of Congress that development of the vaccine was delayed for decades because of these flawed studies on monkeys. So what about all the lives lost there? Antibiotics, very similar story played out. We tested, Alexander Fleming tested penicillin, the first antibiotic developed, on a rabbit in 1929, and it was ineffective. And now we know it's because rabbits excrete penicillin through their urine before it's absorbed in the body. So again, the history behind this is a lot more complicated. And the reality is that people continue to use animals in experiments because that's what they've always done. It's what they've been taught to do. And their whole industry is built up around it. And really, this is the case for any area of industrial animal exploitation, I think. So just to make an analogy, I know recently you interviewed someone from PETA talking about the whole issue of Canada goose and the use of ducks for their feathers, right? To make down. And we have all these new technologies like Primaloft, that can have the same insulative qualities as down. They keep people just as warm. They're functionally equivalent. So why in the world are we still ripping feathers out of ducks? Why would people keep doing that if there's this alternative? Well, the same is true of animal experiments. We do have all these alternatives to use of animals in experiments. People aren't using animals because they have to. It's just because it's what's always been done. And now there have been industries developed around it. And it's really hard to dismantle whole institutions and industries. That doesn't mean that they're necessary. It just means that they're entrenched. And that's what's hard to dismantle.
And Jeremy, one last question. I appreciate you being on the PETA podcast. But, I ask this of a lot of people who come on the show. And that is, what keeps you motivated to continue doing the job that needs to be done? Given that it seems sometimes that the goal is insurmountable. Well, what keeps you motivated to stay the course?
Well, I guess it's two things. The first is I almost feel like you don't have much of an alternative because I think it's sort of like Plato's cave or something, that'll once you're out of the cave and you see the truth, you can't unsee it, and there is just this enormous moral atrocity of animal exploitation that we are surrounded with every single day. Billions of animals are being tortured and killed on farms and laboratories. They're being exploited for entertainment, for their skins. And it's hard to just look at that and say, I'm not going to do anything to try to solve that problem. I don't want to feel that way about myself. I want to think that I would have been the kind of person who would have, stood up during the civil rights era and said, this is wrong, what was happening then, right? So I think it's just an inner sense of wanting to stand up for justice, I guess. But secondly, I think what keeps me going too is I think there really are a lot of meaningful signs of progress. I mean, there's just the word vegan, I see it dozens of times a day in mainstream culture now. And I'm telling you, 15 years ago, that just really wasn't the case. There's just a lot more awareness about these issues. Ringling Brothers was an institution in this country for over 100 years. And now they went out of business. And I think everyone knows that that's because the public doesn't accept that cruelty anymore. Look at all the companies ditching fur. Look at all the cosmetics companies that have abandoned animal testing. Almost all of them now, really. And so you see all these signs of progress and you see that we really are winning. On a day-to-day basis, you deal with a lot of frustrations. No question about that, working on the issue. But if you look back on a longer scale, kind of retrospectively, and have a more level-headed approach at it, I think it's hard not to acknowledge that we've made enormous progress, and that's what keeps me going.
Jeremy Beckham, PETA researcher, thanks for joining us here on the PETA Podcast.
Thank you.
Jeremy Beckham from PETA's Laboratory Investigations Department. Remember, you can do something to stop the forced swim tests and all forms of animal testing. Go to PETA.org. Click on the links in the show notes. You can contact us at PETA.org. Find me on Twitter at Emil Amok, that's EMILAMOK, or on amok.com, AMOK.com. Once again, thank you for listening. Check out all our episodes on Apple Podcasts, where you can rate and review the show. It helps get the word out about the issues you care about. And don't forget, you can help the animals and PETA, especially if you have Amazon's Alexa. Just say, Alexa, donate to PETA. Our music is provided by Carbon Works. Check them out on YouTube. And join us again next time for more insight into animal rights and the fight for a cruelty-free world on the PETA Podcast. Thanks for listening. I'm Emil Guillermo.